you have to notify people as they join the meeting that that's happening. So you'll hear that starting to happen. Vicky, if you could also record that in the minutes, that the meeting is being recorded and that will be posted to the website, that would be awesome.
Eva,
Thank you.
is that recording audio or audio and visual?
It should be just audio.
Okay, because I
So
can
you
see.
can't make faces, Dan.
Yeah. Well, nobody can see my wonderful Patriot hat, New England Patriot hat.
We'll visualize it in our minds, and it'll be awesome.
Maybe I'll take a picture and you can send it out with the minutes and agenda.
There you go.
This is Marla. A quick question. I chaired for 3 months. Do we have a chair for today and the next 2 months?
Great question.
If not, I'll chair. I have the agenda and everything.
If no one else wants to do it, I can do it, Marla.
Okay, go for it, Dan.
But I'd be happy if anybody else is interested in doing it. Not.
Sounds good. Thank you, Dan.
So who's all on?
Hi, this is Kate Hunt.
Hi, Kate. This is Thelma.
Hi. I tried getting on Skype and it worked great last week and it just won't answer for me right now. So I decided to just go video.
Hi, this is Jessica from DMH. I'm free and going to be able to join you all for about an hour, and it seems like Trish and I will be ships in the night, so as soon as I have to log off, she'll probably rejoin the group.
Yeah. Taking your cue from the... Thanks, Jessica.
Thanks, everyone. I'm going to keep myself on mute as well, but I am definitely still here.
This is Malika. I'm here.
This is Marla. I'm here, and I'll try. I've never used my mute button before, but I'll try to for this meeting. Okay.
All right. Do we know who is not supposed to be calling in today?
Brandy, this is Eva from DMH. Brandy will not be calling in today. She sends her regrets. That is the only person member-wise that I've heard from that will not be around today.
Okay, so we haven't heard from Bert yet then, right?
Right.
And Vicky, is Vicky on?
Vicky's on.
Yeah, I'm here.
So it's about 6 after. It's about 6 after, so I'm thinking we should probably get started if everyone agrees.
Okay.
Yeah, and for the purpose of minutes, I just want to make sure we've got Kate, Thelma, Jessica. Rich was here briefly and we'll be back. Dan, Vicky, Eva, Malika, Marla. Am I missing anyone?
Lynn Cardozo is here as a guest.
Oh, thank you very much.
How do you spell your last name, Lynn?
C-A-R-D-O-Z-O. Car as in auto, dozo as in bozo with a D.
Yep. Okay, great. And L-Y-N?
L-Y-N-N-E.
N-N-E, great.
And I'm the director for the Vermont Communication Support Project, a program of Disability Rights Vermont.
Oh, good.
Oh, excellent. So you work with Ed and Jack?
Yes.
Yeah, cool. Great organization. All right.
And this is the second meeting that I've attended. I was asked to consider joining the committee, so I'm just sitting in.
Okay.
Well, you would be more.
Pardon me?
I said I appreciate you sitting in, and you'd be more than welcome.
Thank you.
All right. So I guess we'll get started here. So I've got the agenda in front of me today. As usual, we'll start with introductions and doing what I'm doing now, reviewing the agenda. We'll look at the March minutes, vote on them. Let's see. The next thing we have is the letter to the DMH commissioner, membership update, followed by DMH update. And I guess based on Eva's earlier emails, we're going to kind of have to be flexible as to timing for that, right, Eva?
Correct. Our last communication from Sarah sounds like she is available at 12:30, so that's when we probably will hear from her.
Okay.
Oh, good.
All right. And then we'll take a break and then get back to standing committee business with a discussion of the ANSA update, and then about our committee, in particular, communication, facilitation, and look at strengths, what we need to improve, and changes, recommending, followed by public comment, and then looking at April agenda. Does that sound good?
Yep.
All right.
Good.
I signed it because I was trying to use a Skype app on my phone and it didn't take the phone number, so I apologize.
Oh, is this Bert? Okay.
Yep.
Oh, great. Welcome, Bert. So let's quickly do the introductions. We'll start with the committee members. So I'm Dan Toll, member of the committee.
I'm Thelma Scout, member of the committee.
I'm Marla Simpson, member of the committee.
Field member of the committee.
Who was that?
Vicki Warfield, member of the committee. Sorry.
Got it.
Bert, member of the committee. Bert Dyer.
Oh, hey, Bert.
Hello.
Malika Puffer, member of the committee.
Okay. And then DMH staff who are there?
Eva Dayan from DMH, and just restating that this meeting is being recorded and the recording will be posted along with the minutes to the website.
And this is Jessica Bernard, Assistant Director of Quality for the Department of Mental Health.
Okay, and I think that's it, right? So we have one guest.
Yep, Kate Hunt.
Oh, two guests. Kate Hunt and
Lynn Cardozo.
Kim Cardozo. Great. Kate, thank you for joining us. I'd like to follow up with you sometime later this week by phone, if that's okay.
That would be great.
Okay. Anybody else present?
This is Jack McCullough from the Mental Health Law Project.
Jack.
Yes.
This is Jack. Oh, hi, Jack. How are you?
Good. How are you?
Good. Welcome aboard for the meeting.
Thank you.
And this is Dylan Burns from Vermont Care Partners.
Hey, Dylan.
Hey.
Glad to hear you're joining us. Anybody else? Okay. If that covers the all in attendance, both electronically and in person, why don't we turn to the March minutes? I know Eva has sent it out at least a couple times electronically. First, I wanted to say, Vicki, these are your minutes, right?
I had an early draft sent out. The most recent draft, though, has quite a few corrections in it, but yes.
Okay. I just want to say it was really well done. Thank you.
Oh, thank you. I appreciate that. Thanks.
Yeah. So, anybody have any comments or suggestions on the minutes?
I also thought Vicki did a very good job. I like these new minutes. Thank you.
I appreciate that. Thank you, Marla.
You're welcome.
So not hearing any comments or suggestions, do I hear a motion to approve the March minutes?
This is Marla. I motion to approve the minutes.
Seconded?
I can second.
Thank you, Marla.
I can second. Yep. Thank you, Dan.
Okay. All right, so moved, minutes passed. Okay, so the next item we have is.
I'm sorry to interrupt. I think you have to vote.
Oh, sorry. Yep. My apologies. So, all in favor?
Aye.
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 Opposed? Abstentions? Sounds like it's unanimous.
And my understanding was Marla motioned to approve, and was Bert the one that seconded?
Yes.
Yes.
I did, Vicky. Thank you for checking in. Yes.
Okay, thanks.
Yeah.
Okay. All right. So the next item is the letter, the letter to the DMH commissioner. This was your letter, right, Malika?
I initiated it, yeah.
Yeah, I mean, right, you initiated it and we all took a look at it, and those who had comments provided them, and those who were willing to, who wanted to be included, communicated that to you, correct?
That's right. And I did get to speak with everyone, and people had varying levels of involvement in giving specific input and feedback, but at a minimum, everyone agreed with the main points being made, and gave consent for me to share that on their behalf.
Okay. Was there anything that you wanted to say about that letter at this point, Malika?
Just that I'm looking forward to hearing a response from DMH. Happy to answer any questions anyone has about it also, but I don't know that I have anything to add at this time. Maybe others do.
Yeah, well, it was. Bert, was that you? Go ahead.
Please, Dan, after you.
No, I was just going to say it was a very thorough, thoughtful document, Malika. Kudos to you for really taking the time to delve into that much detail, and particularly on such a critical topic. I mean, not only for the times we're dealing with now, but a lot of the issues are just sort of generally worthwhile considered in any context. So thank you so much for taking all that time. So,
thank you.
Yeah. So Bert, did you have a comment?
I was just wanting to reiterate briefly the sentiment that I expressed in email response to Malika's effort. I'm very grateful for reaching out to me and to the rest of the committee. And in short, I definitely agree with pretty much all of the suggestions put forth, with the exception, unless it be a temporary release of prisoners due to a positive result on a prison. I don't think treatment should be subjective and limited only to those that test positive. We don't have a cure for this freaking horrible disease yet, but I was just wanting, again, in short, to reiterate my gratitude and thank you for your work, Malika.
Yeah, thanks, Bert. And just to respond to that point about releasing prisoners, I think that wasn't so much to advocate that prisoners be released, because that's sort of outside of the scope of our committee, I think, but more to just reference that as something that is happening and that maybe could support a case for releasing more people from psych hospitals.
Sure. Yeah,
That's a good point, Malika. This is Marla. I really want to reiterate what everyone's saying, that Malika took tremendous motivation and gratitude for doing that on behalf of the committee. Can I just quickly say one little thing about why I didn't write more in the email?
Absolutely, Marla, go ahead. Yeah.
My new computer constantly erases what I write, and I don't know why. So that's why my emails are so brief.
Oh, that's got to be incredibly frustrating. I can't even imagine.
I just want to thank you too, Malika, and I join everybody else's kudos to you.
Thanks, and thank you all who contributed. Vicki did quite a bit of work. We spent quite a lot of time talking about these ideas, and really with all of you, appreciate your effort that went into this.
This is Vicki. I just wanted to chime in and say that the some of the ideas that are in this letter, some of the ideas that Malika came up with, I know that she talked to a lot of people who have a lot of knowledge about this area, and I think came up with a lot of really specific suggestions. And I'm just really hoping that DMH is able to address the specific suggestions and kind of weigh them on their merits and kind of use them as a great platform for discussion on how to keep not only patients safe, but I think there are also some really good suggestions about treatment of staff. So I really loved how specific it was, and hope that can be that the response can be similarly targeted. Thanks.
I should share with the committee also that I got a number of emails in response from different community members and organizations and state senators and representatives about it, and many of them expressed interest in hearing about what resulted from this. So I'll be following up with those people after this as well to keep them in the loop as they requested. And overwhelmingly, the response from a really diverse group of people is really enthusiastic, so that's good.
Yeah,
That's amazing, Micah. Kudos.
Okay, which leads to my next question, and you may have communicated this already, Eva. But so what actually has been done with the letter now? Has it been? I assume it's been delivered to the commissioner, to Sarah.
Correct. It was delivered to both Sarah and Fox, the commissioner and deputy commissioner,
Yep.
via email, and then it was also posted to the State Program Standing Committee minutes page of the website. So it's kind of publicly available as part of the documents that you created, and also was delivered to them directly. And I just want to give everyone a heads up to check your email, because Sarah, in preparation for today, has sent out a document, and so that should be in your email right now. I don't know if she's going to speak directly to it or not, but keep a lookout for that.
Okay, I have received it. Thank you, Eva. Okay, so I'm assuming that we will have an opportunity to talk about the letter when Sarah joins us for the update. So the last item then, it's 1221, is a membership update. Eva, do you have an update in terms of where we stand with prospective members?
I think the update right now is that you are at 7 members currently, and there is one application that was just received from Kate Hunt. And so the membership committee has received that and will be reviewing that. I believe this is Kate's second meeting in attendance. And so when the membership subcommittee is ready to bring that to full membership to review, then that will be added to the agenda.
Right, and as you all heard earlier, I'll be reaching out to Kate to talk to her about her application, but also to answer any questions she may have. So I'll be and then checking references as well. So that'll be my responsibility to do the follow-up on the application piece. assuming, Kate, that after this meeting, you're still interested in being part of the committee.
I think you can count on me.
Hopefully we don't scare you away. So I'm trying to think of the people that have attended over the last number of months. There was Joanne who's attended.
Joanne, who is the state representative, Beatrice from Inner Fire.
Beatrice, have we heard anything from them, Eva? Have they done an application, I guess, is the first question.
No other applications have been received. Joanna Cole has been following up pretty consistently and had planned to attend today's meeting and just wasn't able to last minute. She had something come up. Beatrice, we have heard from on and off. She, I think, plans to attend next month, but wasn't available this month.
Right.
I think everyone who's been kind of following up with us.
What about Brandy Parker?
Yep, so Brandy's application was submitted to the governor, and she's considered a member until or unless we hear otherwise. And she was unable to make it today. She sends her regrets.
All right, thank you.
Okay. So, all right, so that's where we stand in terms of prospective members. Anything at this point that we're doing or should be doing to reach out? Anybody have any suggestions or reports?
Just that 3 people from the DMH conference at Killington last fall. I will be happy to follow up with them via phone tomorrow.
Okay, great. Thank you, Marla.
Of course, you're welcome.
But right now, we're with 7 members and 3, 4 prospective members. That's actually very, I think, very good, in terms of the getting the committee to a point where we're fully staffed, so to speak. So that's great. Anything else relating to membership? Does anybody have anything else? Okay. All right. So it's 12:25, and I guess as of now, we're still expecting that Sarah's going to be available at 12:30. Right, Eva?
Correct.
So
Dan, maybe we could use these few minutes to just read as much as we can of the document that was sent out.
Oh, great idea. Yeah, so as Eva said, she sent out an email, which I have received, which is a memo. Obviously not everyone's going to be able to look at it, but it's from the Commissioner Sarah Squirrel. It's dated today, and it's an overview of priorities and actions relating to COVID-19.
Yep.
Let's see, it's about 10 pages, so we're not going to have time to go through it, obviously, line by line, but I'll just quickly tell people what's in the document, and then we'll leave it to Sarah as to what she wants to address. But basically, it's an overview that talks about the 3 priority areas from DMH relative to the coronavirus. She talks about, she does a summary of pressures in the system, and then that's followed by 8-page grid which delineates the fiscal and programmatic program strategies and implementation. So it starts with a phase 1 in the middle of March and outlines what fiscal strategies and programmatic things are going on, talks about school-based issues. Phase 2, which started March 23rd, got into collaboration with DMH and the Department of Aging and Independent Living, communications issues, funding issues, SAMHSA, which is the Substance Abuse and Mental Health Services Agencies, this is basically the federal agency that oversees mental health and substance abuse issues across the country. There's a discussion of crisis counseling program, which is, I guess, FEMA funds. There's a discussion of the alternative inpatient facility, something called MTCR update. And I guess, that's the Middlesex Therapeutic Community Residence, which members may recall Brandy Parker has agreed to be, right? Or Eva has agreed to be the committee member representing the committee member, our committee member, who's going to be participating in some of the design discussions relating to this new facility.
Correct.
Right, Eva?
Yep.
And then finally, then there's a discussion of next steps focused on the fiscal or the money issues and communications, and then there's some charts and background information at the back. So just as I'm scanning through it, it appears to be a very thorough and detailed document. To me, it looks like it represents pretty thoughtful approach. Obviously, I haven't read all the whole 10 pages.
This is Vicki. I have a question for Eva. Eva, I really appreciate you posting the letter, Malika's and the committee's letter to the commissioner on the website. I'm wondering, could we have a section where we have minutes and then we also have other documents so that we could post this to the website also?
Can you clarify what you're requesting? Because currently there's the page on the website that's for state program standing committees that includes minutes, the current agenda, and that's where that document lives. So I'm wondering kind of what your request is.
I'm just saying that it seems like it was very useful to post our letter to the commissioner. I'm wondering if we could also post this information we just got from Commissioner Squirrel, and there maybe we could have an area for documents such as this.
Oh, sure. So documents relating to minutes to that meeting, for example. Maybe attached to the minutes themselves so that you could open up the minutes and have all the attachments with it.
That would be good. I think it would be even better if they could be separate from the minutes so that people can search them even if they don't know the specific month that they came up or were discussed.
That makes sense. I can talk to the website folks and see what our capacity is for doing that, but that sounds like a clear request.
Great, thank you.
And I would agree with that question because it's a measure which encourages transparency in the DMH. So thank you, Eva. Thank you, Eva and Vicki.
Eva, I have another question, which is, could you give us an update on the current census in hospitals? How many beds are open and how many beds are full?
Current census in hospital, how many beds are open, how many beds are full? Do you want to know how many beds are currently considered closed as part of that count?
Yeah, that would be great. Thank you so much. And if it's possible to have it broken out by location, that's also helpful.
Sure. It probably won't happen before the end of the meeting, but I can send that out as an email afterwards.
I found it interesting that on this letter, page 8 actually has the inpatient census and what's happened in the past since March 1st to April 8th.
Good morning. This is Commissioner Squirrel. I just want to let you know that I've joined.
Oh, great. This is Dan Toll. Sarah, thank you for joining us.
Of course.
Before you joined, I just went quickly through the document you sent us to give the what the sections are and what you included, so people have an idea of what the content is, not the specifics. So I'll hand it over to you as to how you what you want to specifically address, and then we'll open up for questions.
This is Eva. I'm just checking in to let you know, Sarah, this meeting is being recorded.
Yep, understood. Thank you.
Thank you.
It's Tom Weigel, the medical director, also on the call.
And so is Morning Talk.
Welcome.
Okay.
Welcome, Jeff. Thank you for joining us.
Of course. Good afternoon, everyone. I hope you're all doing well. I did send out a document. It's intended to be an overview of the priority areas that the Department of Mental Health is focusing on in light of managing our response to COVID-19 across our state system of care. It gives you an overview of some very specific strategies that we have put in place that I will take a few minutes to walk you through. I know there were also some questions just related to managing overall census in the hospital, so I have provided some data there. I also do have the current data in front of me, effective this morning, of capacity across our designated hospitals. So if there were specific questions, I'm happy to answer those. But I think I'd probably just start, Dan, by going through kind of the overview so you have all the information, and then trying to ensure we have adequate time for questions.
Great. Sounds good, Sarah. Thank you.
Of course. So obviously, the Department of Mental Health's sole focus is on the health and safety of Vermonters. This has been an incredible time of uncertainty for all of us, for those who we provide care and treatment to Vermonters and to our providers across the state. We certainly know the impact on, our youngest Vermonters, vulnerable children and youth, who are no longer accessing supports to their public schools like they might have before, to adults who are currently in our inpatient settings or maybe isolating at home, maybe needing care, as well as our older Vermonters who we were already worried about in terms of isolation. So right now, our focus has really been to ensure that the overall fabric of our mental health system stays strong to meet the needs of Vermonters for today, and also to ensure that that system is still strong when we come out the other side of this. So the three main priority areas that we've really focused on is, number one, the fiscal stability of our community mental health providers and inpatient providers. The impact of COVID-19 has shifted things significantly for all of us. Incredible staffing shortages as individuals need to stay home to take care of themselves, their loved ones, or their children. That has put a lot of pressure on our inpatient facilities as well as our community mental health providers. We want to ensure that there continues to be access to and adequate capacity in our mental health system. That includes both community mental health and inpatient. And we, of course, want to support and sustain our overall mental health care workforce. The pressures that we're seeing across the system right now, just to give you kind of a high-level view of what we're hearing a lot about and grappling with every day, is maintaining critical and essential staff to keep our facilities open, to keep our residential programs open, to continue to provide community supports. That also includes our inpatient settings. A lot of fiscal pressures on providers due to loss of revenue, increased costs, and efforts to maintain staff. We have seen decreased capacity across the system. We, of course, I think to some of the points in the letter that you provided to the Department of Mental Health, have engaged and supported the inpatient system and appropriate discharges to ensure that those who can receive services at the community level or in a least restrictive setting can. At the same time, I believe we are also seeing closure of beds and units simply to manage the lack of staffing that we have as a system of care. And we'll talk a little bit more about that. I would also say that the staffing shortages that we're seeing include inpatient, it includes community mental health, it includes residential and our crisis beds as well. One of the other areas that we're trying to work on is the procurement and acquisition of appropriate PPE for our 24/7 direct care staff across the state. And of course, trying to support our providers in managing the myriad of guidance that is coming out on a daily basis. Our understanding of COVID-19 is fluid. Understanding the current guidance, the safety precautions that need to be put in place is in and of itself a full-time job. So really working with VDH to ensure that our providers have all of the up-to-date and current information about how to be in compliance with guidance. I want to talk about some of the things that we've already implemented that serve to achieve those priorities and some of our goals and some of the pressures that we're seeing across the system. So when we look at our community mental health system, our network of providers are our community mental health agencies. And so we immediately kind of sprang to action to ensure that we could support them and their fiscal stability. They, of course, were grappling with significant staffing shortages, the stay home, stay safe order, schools being closed. So their workforce, they were challenged to retain and keep in place, as well as things like the provision of school-based mental health services, for example, is a big part of our community mental health agencies and their revenues. So that loss of revenue also becomes a hit for them. So DMH and Dale have really worked side by side to support our network of community mental health agencies and SSAs. We were fortunate in that we already have a fairly progressive payment reform mechanism in place through a case rate. And that case rate allows us to pay our providers a monthly prospective payment. And so what we were able to do quickly is recognizing that the provision of services was changing, meaning we were going to be using more telehealth, et cetera. And that utilization was changing. But at the same time, we've been able to maintain the prospective payment and case rate payment that all of the designated agencies receive, because we know that we can make an adjustment on the back end from a utilization review standpoint, et cetera. So really creating as much flexibility as we can within the case rate to ensure that our providers continue to receive their regular monthly payments. For residential programs, they operate fiscally through the PNMI rate setting process. So again, we created flexibility in that PNMI process because again, in some of our residential programs and our crisis beds, they may be discharging individuals, which is very appropriate, back to the community, back to home. But at the same time, that means they can't bill for the census or the revenue. So we've created a similar process for PNMI, whereas you may have a lower census, but the Department of Mental Health and Dale and DEVA are still going to ensure that you have adequate funding so you can maintain that full capacity. Because we know that as we emerge or come out the other side of COVID-19, those resources will be absolutely essential. Also, the provision of telephonic services was approved by Medicaid for a variety of mental health services and treatment, which has really allowed us to continue to provide mental health services even under the stay home, stay safe order. We expedited payments for electronic medical records to all of the designated agencies. And for school-based mental health, we were actually able to implement an emergency case rate for the provision of school-based mental health services, which allows continued supports to be offered to children and youth across the state, obviously through a very different format, but with the collaboration of the Agency of Education and the Department of Mental Health, we have made it clear that we want the provision of those services to still continue. Again, knowing that we have many vulnerable children and youth who are now at home, and they and their families continue to need support. So that's a quick summary of some of the fiscal pieces that we've put in place to ensure that our community-based system of care is strong. We've also implemented phase 2. Many of the community mental health agencies, as you can imagine, have increased costs due to COVID-19, additional losses of revenue that we haven't been able to account for through some of the mechanisms that I just mentioned, implementing hazard pay and incentive pay to ensure that they can keep folks in these face-to-face positions. So phase 2 is where all of the designated agencies and specialized service agencies can provide to the Department of Mental Health an additional funding request or funding request that they may be making. DMH and Dale have a methodology to review and evaluate those requests. And those requests will be evaluated and prioritized based on available funds and coordinated with other financial relief efforts in the Agency of Human Services. We also have a few we're keeping our eye on the federal stimulus package, of course, for Vermont. Department of Mental Health and ADAP have applied for a SAMHSA grant, as well as a crisis counseling program that will, if we are successful, will be available utilizing FEMA funds. That's essentially a quick overview of how we have worked very hard over the past few weeks to ensure fiscal solvency and stability for our community mental health partners. DEVA also has a similar process in place for hospital partners who need to make requests for financial relief. And the Agency of Human Services is also currently working with the Brattleboro Retreat to understand what fiscal pressures they might be under and what additional relief might be required there as well. So I'm going to pivot to a couple of just movements and capacity pieces in the system of care. I want the Adult State Standing Committee to be sure that you're aware of and apprised of. Number one is our consideration of an alternative inpatient facility for COVID positive patients. So back in late March, when things were starting to unfold and we were looking at overall trends and modeling across the state, where it looked as though at some point we could be exceeding our overall medical bed capacity across the state of Vermont. Of course, it was an immediate priority for us to think about, for individuals who might be seeking inpatient care or waiting in an ED for inpatient care, how do we ensure that we have adequate capacity for those individuals? So DMH convened all of our designated hospital leadership from across the state to make a recommendation on what we thought we needed. The network of hospitals determined that there was a need to establish an alternative psychiatric facility. I think at that time we were thinking maybe 1 to 25 beds. I think at this time we're now thinking maybe 1 to 10 beds. And this is for individuals.
Excuse me.
Yes.
This is Malika. Can I just interrupt 1 second?
Sure.
I know that we have a very limited amount of time, and most of us have this document in front of us and are familiar with some of the response. I'm wondering if we can prioritize questions.
We can, if everyone feels like there have been some shifts and changes in how we've been thinking about the alternative facility. So if everyone feels like they have all of the information, then I'm happy to stop and just take questions.
Maybe you could update us just on the changes.
Could you just repeat the last numbers that you provided us with? And
then... This is Vicki Warfield. I just wanted to.
Okay.
I'd like to make a motion that we can waive our standard rule of having community members wait. I believe we have 10 minutes scheduled for feedback from the community, but I think given that we have have quite a few guests and guests with some expertise in here today. I'd like to waive that rule and allow them to ask questions of Sarah also.
I second that motion.
All in favor?
Aye.
Aye.
Anybody opposed or abstention? Okay. All right.
Thank you.
So Lynn, Kate, Jack, anybody else who's on the line, feel free to ask questions.
And
Thank you.
maybe, Sarah, you could just very briefly update us on any changes or updates to the document that we have, things that we don't currently have in front of us.
So one of the pieces to be aware of is that originally when the Vermont Department of Mental Health was looking at an alternative inpatient psychiatric facility, Woodside was named as a potential location. And what I wanted to do was let the Adult State Standing Committee know that we have pivoted away from Woodside as a location and are looking at an alternative location that is connected to a medical hospital.
Thank you.
You're welcome.
Could you speak to the recommendations in the letter from this committee and what of those you have or plan to implement? And yeah, we'll start there, I guess.
Sure, I'm happy to. I would invite Deputy Commissioner Morning Fox and Dr. Weil to jump in at any time. But I believe that, and it looks like, correct me if I'm wrong, but this was a letter that was generated maybe by a national or international organization that then came through the Adult Standing Committee and was provided through the Department of Mental Health.
No, this is one that we just did, and it took some point from an international letter, but.
Great, yeah. Yeah, that was my understanding. Thank you. So in terms of overall admissions, you can see as the chart indicates, which is why I shared this, just looking at overall inpatient census across Vermont, that of course, as we were staring down a pandemic, all of our inpatient hospitals, including our care management team at the Department of Mental Health, of course, work to ensure that where appropriate discharges could occur, that was something that we work to facilitate. And you can see overall the general trend lines in inpatient census across the state of Vermont. So in terms of the request for what I think is the spirit of what you're looking at is, for those who don't need to be in these inpatient settings, can we appropriately discharge to community-based level of care, which is, I think, what this chart indicates in terms of not allowing individuals who might need and benefit from hospital level of care is not something that the department is moving forward with right now. We certainly want to ensure that anyone who needs and meets hospital level of care and would benefit from hospital level of care can continue to access that.
Sarah,
so just to clarify, I won't take up all the time with my questions, but just to clarify, appropriate discharges, has the way that those decisions are made changed at all given the current situation?
I don't know that anything has changed significantly other than an emphasis on ensuring and working very, very hard to ensure that where it is appropriate to discharge someone, that has been a real focus of our care management team and of the inpatient hospitals.
This is Dan. For those who don't have the document in front of them, the chart that Sarah was referring to shows the census starting March 1st up through April 8th, and looking at the trend line, it essentially, just round numbers, the census has gone from almost 200 to close to 100. So it's basically cut in half. Mm-hmm. So my question is, in general categories, not specific places, but in general categories, where have those patients been diverted to? And then it's probably too soon, but can you talk about positive and negative impact of that? Moving people out of the inpatient, the higher invasive therapy to the community setting, which would be less invasive in general.
Yeah, I can't speak to the specifics right now in terms of where and how individuals were discharged. I'm sure I could ask my care management team to do a little bit more research on that. And I'm sure they've actually probably hand coordinated many of those discharges. I'm not aware of any negative impacts currently of individuals who have been discharged at the community level, other than the fact that our community mental health system is also under incredible stress and pressure. So I know our community mental health agencies and specialized service agencies have been working very hard to support those individuals. But I'm not aware of any negative impacts at this point. I don't know, Deputy Commissioner Fox, would you have anything to add to that?
Yeah, no, this is Morning Fox. One of the things I wanted to add to that is that in general, I think what you're also seeing over the course is, as Dan mentioned, you look out at that the data on the report that Commissioner Squirrel provided. Dan, you're right. It does look at a overall census of close to 200, and over the course of a month, we're now still above, but closer to about 100 folks. And I think part of what we're seeing is not only a focus on trying to ensure that people are being discharged, et cetera, but we're also seeing an extremely low number of people who, over that same time frame, have been presenting for inpatient level of care. And so I think we're seeing a decrease of the census in the inpatient system, partly because of the discharges, but also partly because there's a significant decrease of individuals who are presenting and in need of an inpatient level of care. And I think there's a number of factors that are showing kind of that suppression in the need. But I think those two factors combined bring us to the current census levels.
Hi, this is Marla with a question. Commissioner Squirrel, do you have a second?
Sure.
Yes, the crisis counseling of which you just spoke, is that going to be originating from existing crisis lines or centers or VSL, Vermont Support Line, or something like that? Or is this SAMHSA grant, is that for new funding?
It's a great question. It's for new funding, and that would be coordinated with our existing service providers. Maybe that's with an SSA or a designated agency, and we would essentially use those funds to enhance some of those counseling programs that are currently available.
All right, great. Thank you.
So, Sarah, how long are you able to stay with us?
I can stay on the phone for another 10 minutes or so, if that would be helpful.
Okay, that would be great, because it's now about 4 minutes. It's till 1. I guess I'd like to first ask any of the other committee members who haven't had a chance to ask questions, if you could raise your questions, and then I'd like to hopefully leave some time as we have made the provision for members of the public to ask questions. So any other committee members have questions?
Yes, this is Vicki Warfield. I have 2 questions.
Yeah.
One, the first is, are any additional steps being put in place to ensure that people are not discharged to homelessness? I know that that's been an ongoing issue outside of the pandemic and is of increasing, significantly increased importance with the pandemic going on. And then my second question, to keep things brief, is what steps are being put in place to protect staff members, not just allowing staff members, obviously from home, but just kind of the overall strategy for keeping staff members safe.
I don't know that I can speak to question one. Maybe Deputy Commissioner Morning Fox, you can speak to the discharge piece related to homelessness. In terms of protecting staff, certainly at all of our facilities across the state, we've been working very hard to employ the guidance that's been provided by VDH. So that's inclusive of community care providers, residential providers, inpatient providers, et cetera. And also the Department of Mental Health, myself personally, has been working very hard with our Emergency Operations Center here to advocate for and ensure that our community partners in particular have adequate access to PPE. So for example, I personally hand shepherded an order for all of the designated agencies and specialized service agencies through the Emergency Operations Center to ensure that they have adequate access to PPE. So that's
and
just
given that you've mentioned some concern, I believe, about staff shortages, has there been any consideration to offering some sort of hazard pay or incentives to staff members who are outside of the highest risk groups to continue serving in an at-risk population?
So one of the phase 2 requests that I was giving an overview of earlier is related to hazard pay and incentive pay for designated agency and SSA employees. We asked the designated agencies to provide us with an overview of what that request would look like and what they would need. We've prioritized that request and has made a recommendation to the secretary that he reviewed on Friday afternoon.
Thank you.
This is Tom Weigel. I just wanted to comment on the homeless piece. I don't have statistics on where each individual was discharged, but I do know that in the state over the last number of weeks, there's been a huge effort to make sure that the homeless shelters that are still existing are safe. That there's been a large increase in hotel and motel vouchers. That there's a large number of people who are homeless living in places like the Holiday Inn in Burlington. So I know that that was one of the points that was made, I think point number 3, that people who wish to leave the facility but may not have a safe emergency living placement. But I know that there's been a lot of efforts statewide and a lot of money invested in that.
Thank you.
And this is Morning Fox. I think Dr. Weigel is exactly right that the system in general has worked very hard at basically kind of putting on hold your traditional congregate shelters and anyone who is experiencing homelessness. The state has been working very diligently and hard to provide vouchers and hotel rooms and other emergency housing for folks. The one thing I do like to say, and I've said this before, is that I'm very proud of the fact that it's an extremely rare circumstance for someone who's under the care and custody of the commissioner to be discharged from a hospital to homelessness. And the circumstances when that does happen, it's almost always because that is the individual's determined, that's their determination, that's their chosen particular living situation. The department works very, very hard at trying to provide other stable housing situations for individuals, particularly those under the care and custody of the commissioner.
This is Vicki Warfield. I just had one last thing, and then I'll let you go. I know time is very short. I just felt a need to say, just speak from my experience as the former patient advocate for the Brattleboro retreat. I know the main concern, the biggest concern I was called about as a patient advocate was patients very afraid of homelessness, and I did have I had a gentleman discharged on a day when it was about 10 degrees out, and he had no coat, no home. So a lot of time was spent driving people to different counties to try to find, shelter for them. But I understand that there are motel vouchers now. I understand that that's an issue. My very last question is somewhat related to that. Is just what is the Department of Mental Health doing to ensure that patients have knowledge of and access to patient advocates during their hospitalization.
So this is Sarah. One of the things that we've been working on is obviously using as technology to our advantage in terms of virtual pieces. This was also noted in your letter in terms of how, you know, we have a cohort of staff now who are now working from home, and they're using, you know, telehealth and telephonic and virtual check-ins to support individuals. We've had to stand up almost in such a short time period, kind of a virtual legal system, whereas individuals can still communicate with their attorneys, et cetera, and ensure that continued access to care, or access to legal guidance. So in our inpatient facilities, I can speak more specifically to VPCH, that individuals there would be able to continue to communicate with any patient advocate, someone from Vermont Psychiatric Survivors, but that would just need to be coordinated kind of virtually. I can't speak specifically to what the Brattleboro retreat is doing right now, but I would assume and would hope that we would be employing technology to ensure that individuals who needed those connections were still able to make them.
This is Vicki. My understanding is that the patient advocate from Vermont Psychiatric Survivors for Vermont Care Psychiatric Hospital is actually on medical furlough, and that there is no access at that site for a patient advocate. Would DMH be open to distributing to every patient a sheet of the advocates that are available and the organizations for advocacy that are available with phone numbers?
Would that be something that would be coordinated through Vermont Psychiatric Survivors as the entity that provides that? Is that what you're suggesting, Vicki?
No, it's not. They're one entity that provides that service, but there are several advocacy services available to patients that I find that patients often are not aware of if they're not provided with that information. And specifically, since advocates aren't visiting hospitals right now, I know like DRVT often does, Vermont Psychiatric Survivors had before, before the medical furlough, but now, that's prevented due to COVID-19. So it seems particularly important for patients to know the numbers that they can call to reach advocates and know that those services are available, since the advocates can't come to the hospital to inform them. I was wondering if DMH would be open to distributing a flyer that has that information on it so that patients can reach advocacy organizations.
Yeah, I mean, it seems like a similar, reasonable request from my perspective, Vicki. We can talk with our team about that more and see if we can implement that.
Yeah, not only circulate something like that, but post it in public places within the facility. That would be great.
Sure. Yeah, makes sense.
And just FYI, NAMI, I've been doing support groups at VPCH, and we're talking about trying to do those electronically, so that they'll have access to peer support as well. So Bert and Thelma, do you have any questions?
No, I think the one question I was thinking about was already answered, so I'm fine.
I am much the same. I've been taking notes and stuff, but like most of my questions have been addressed. So
great. And how about?
This is Malika. I have more questions, but I would like to make time for the public. And hope that we can continue asking questions even after the commissioners left us.
I just wanted to say Commissioner Squirrel said she had 10 minutes about 15 minutes ago.
All right. So what about any questions from the members of the public?
None at this time. That's Kate.
This is Jack.
Okay.
This is Jack.
I have a question.
Who's this speaking?
My name is Laura Ziegler, and I have a question.
Oh, great.
Is
Excellent.
VPS actually carrying out the patient representative work?
Yes, it's my understanding that they are.
Well, my understanding is that at least one patient rep was given the option of working for a warm line or training and working for a warm line which was unrelated to being the patient rep, or just going on furlough until July.
So,
and I think the way the law reads, it's actually DMH that's responsible for contracting and presumably managing the contract and ensuring that it's actually being carried out. So I would hope that this was something that was being monitored and ensured.
Yeah, I'm sorry, I didn't catch the name of the individual who was making the comment, but we're more than happy to follow up on that in terms of the grant and contract that we have with Vermont Psychiatric Survivors.
Good.
Thank you.
Kate, Jack, or Lynn, anything from you all?
Nope, not
Yes,
at this
I
time. Thank you.
Nothing from me.
Vicki, I really appreciate Laura's question, and I'm wondering if Eva can email or notify the members of the committee as soon as we get a follow-up response to that.
Sure.
This is Marla. I just wanted to thank everybody for the good dialogue. I felt like it was a good Q&A, and I just wanted to say thank you.
It sounded like there was a member of the public trying to make a comment, maybe. Is that true?
Yes,
was
this is
just
Jack.
like-
Can you hear me?
Hi, Jack.
Was that?
Hi,
Go ahead,
can you hear me? Okay, thank you. I'm looking at the table on page 8 of the handout, and I'm curious if it's possible to break that the census numbers down between voluntary and involuntary, and if it's possible to know how the census reduction for involuntary patients has proceeded.
Sure, Jack. I can ask our research and stats team to see if they can break that down. That's not a problem.
Thank you. And, I'll just throw this out because we're always talking about relying on community resources. It's kind of like what we hear, people are talking about reduction of census in prisons and jails. Once the emergency goes away and we find that we've been able to reduce the involuntary census in hospitals, why shouldn't we keep it down at that level rather than letting it go back up?
Yeah, and the great question, Jack, and maybe Sarah, you might want to talk about that in the context of the 10-year plan.
Yes, well, I think that certainly aligns with our vision, which is as we work towards more integration practices across our mental health system, as we increase community capacity, we should be able to achieve less reliance on our inpatient and an inpatient system. What I don't know is what the need is going to be when we come out the other side of this. As Deputy Commissioner Morning Fox mentioned, the first email that I read every morning when I get up is how many individuals are waiting in an emergency department to access care. That picture has changed drastically. And I certainly, our goal is that individuals can be served in the least restrictive settings as close to the community level as possible. I also want to make sure that for those who may benefit from and need high quality inpatient care, that they can access it. So what are the trend lines going to look like at the end of when we come out the other side of this? I'm not sure. If we can continue to maintain less need within our inpatient system and things are shifting, that will be something that we can, of course, look at as a state system together.
Okay, thanks.
Yeah.
This is Malika. I just want to reflect that I would like to see more clarity and have some questions about the way that DMH plans to prevent infections, the spread of the virus in inpatient units, and the response when that happens. I would like to also see that be a priority area, the safety of people in inpatient and residential settings. And related to that, if it would be possible to get a response, a more detailed response to our letter, or any response actually would be lovely. But going through point by point, I'd be really curious to know what ideas DMH agreed with, but there are logistical barriers to, or which ones you aren't or haven't pursued because of disagreement with the suggestions and what that's about. So if that is possible, that would help me have a lot more clarity about where you all are coming from and some of the plans moving forward and how we can fit into that planning process.
So all of our inpatient hospitals have comprehensive infection control pandemic teams. I mean, the degree of planning that our inpatient facilities and VPCH in particular have been going through to ensure patient safety and staff safety is incredible. The easiest way for me to kind of translate that information publicly, I'm not sure. I can see we certainly have taken all the guidance from VDH. Everything that I included in the document is all the guidance that has gone out to our providers. If there are specific plans related to how VPCH in particular is managing its infection and control and those protocols, I'm sure that's something that we can provide to the Adult State Standing Committee. I can assure you that there is incredible thought and countless long hours that has gone into keeping everyone safe. And I want to commend our team at VPCH for their incredible work. Regarding answering all of the questions in this letter, my presentation that I provided was intended to hit on as many of those as I possibly could. Certainly within our available capacity right now as a department, we're happy to try to spend some time providing responses to those specifically. We are in the midst of a global pandemic that none of us have faced in this lifetime, and it is all hands on deck right now for us as a department. I can assure you we are all working triple time hours to support our system of care, and certainly will do our best to put some time and energy into responding to the letter that you sent.
Yeah. Perhaps as a suggestion, Mike, if you and I are willing to do, I'm happy to work with you. After reading this document and getting the feedback, the great feedback we've gotten from Sarah and her staff, maybe we could pinpoint what specific questions we have to help them, help us get answers to things that we don't have, but also be more focused. Does that sound?
This is Vicki Warfield. I just wanted to say I really appreciate the presentation that Sarah has given us, and with the document coming after the beginning of the meeting, obviously I haven't had a chance to read the 10 pages, but I also really appreciate the thought and collaboration of many people that's gone into the very specific suggestions in the letter, and would love to see a written response from DMH on kind of some of the very specific targeted suggestions in the letter. I'm not sure if revising the letter to be, to have a second version of the letter for a response would necessarily be saving DMH very much time, but I would just love to see kind of a written response to some of the specific things that have been raised.
I apologize. I do have to jump off and jump into a meeting with the secretary. As I said, we will look at the letter. We will, if there are things that we feel we have addressed in the information we've provided, we'll probably just note that. And then if you do have priority areas, Dan, I actually thought that was a great suggestion. It would certainly help me and our team kind of manage really targeted responses to some areas that might be hitting a really high priority for you, or areas that you feel like weren't adequately answered in the information we already provided. But like I said, we'll work within our existing capacity to look at those questions and get something back to the Adult State Standing Committee as quickly as we can.
Great, thank you. And thought
your time, and thank you, and many blessings and prayers to everybody who's dealing with this horrible virus. So I just want to exude some compassion for the toll that it's taking on the globe right now, as well as Vermonters.
Yeah. Thank you, Marla. Fox, if it's possible for you, you had mentioned there's a number of factors that related to the decline in the demand for inpatient beds. If there's anything you could send to Eva to distribute to us with that explains some of that, that would be great.
Yeah, and more than willing to do that, Dan. It's more that it's conceptual as opposed to some statistic that I have that shows this is, cause X or cause Y. But there's a number of different philosophies or ideas of why we're seeing that slowdown in presentation.
That would be great. That would be great. Well, thank you, Sarah. And we took more time than we had on the agenda, and we really appreciate you staying with us and to answer questions, and also taking all the time to prepare a document that we can review with answers to things that we have on our mind.
Of course. Well, yeah, thank you all for your time. Really appreciate the great leadership of the Adult State Standing Committee. Please, of course, follow up with Eva on any additional questions that you might have. We really want to do our best and keep the lines of communication open, and just, again, continue to appreciate your leadership across our mental health system of care. So thank you all.
Thank you.
Thanks.
Okay, it's now about 1:18. The next thing on the agenda is a 15-minute break. Jessica, are you still with us?
I am, yes.
Were you going to be available to talk about the adult needs and strength assessment update, or was someone else going to handle that?
I believe that was the committee members that wanted that on the agenda to discuss amongst themselves. I think Malika had attended a meeting, and other members had requested a follow-up to that discussion from the committee itself.
Okay, so that's not an update from an individual DMH. Okay, well, I'd like to propose then that we take our break now per the agenda. And is it okay if we come back at 1:30? Does that work for everybody?
Yes.
Mm-hmm. Sure, yes. I have an administrative question quickly. Is it *6 to mute our phones? I've not used Skype before, so.
I will look into that and get back to you. I'm not quite sure what the keystroke is on a manual phone.
All right.
I think if you're on Skype,
on a manual phone, generally the bottom middle button, it usually says mute.
Yeah, I just used the call-in because for some reason my Skype wasn't working.
I think for the call-in it's been *6, but you maybe have to try that to confirm. Usually it tells you when you sign on with the call.
I mean, that's the function in Zoom, but I've not used Skype. So anyway.
Okay. All right. Well, we will reconvene then in about 10 minutes.
Eva, this is Kate. Can I talk to you for just a sec while I'm here?
Absolutely.
I'm just wondering, I'm on voice, as you know. Does it make sense for me to hang up and dial in again at 1:30?
I think whatever is easier for you.
It's okay to do that, though. I won't be disrupting anything if I do it that way. Okay, I think I'll plan to do that. Thanks.
Thanks.
All right, see you at 1:30. Yep.
Okay. Anybody have requests for background music?
I'm just listening to my cat purring.
Well, I don't know if you all can hear it, but I'm putting on peaceful guitar on Spotify.
Hi, this is Kate. I'm not sure who I'm looking at, but I'm now on Skype instead of dial-in.
Ah, well, welcome, Kate. If you're looking at someone with a red baseball cap, red Patriots baseball cap, that's me, Dan.
I'm not hearing you very well.
This is Vicky. I just called in during Skype too. I had dialed in before, and people are a bit quieter, and I'm not seeing any video. I'm not sure if there's any.
It's Marla. I'm here.
I'm back also. My phone was on mute.
Vicky, I think I'm going to jump off of Skype and call in via my phone. It's just the audio is a bit clearer that way, I think.
Okay, it's 1:31, so why don't we get back to business here?
Do we need a motion to reconvene, Dan?
I don't think so. I think we're okay. So the first item we have is a continuation of the standing committee business, the adults needs and strength assessment update. Did anybody have any particular comments or questions that they wanted to start out with?
This is Marla. I have a question. My concern about ANSA may or may not be shared by other members. I feel that it's just simply a replacement for the GAF, the Global Assessment of Functioning, which gives people a 0 to 100 scale. And I think that ANSA is very subjective, and I'm worried that it's just going to end up pigeonholing people into classifications or boxes, which are most likely going to be fluid and not constant over time. I have some concerns about it, and I know Malaika was originally the person who had concerns.
I also am fairly concerned about ANSA. The website for the Prade Foundation, I don't know. I'm hoping I'm saying that right. Prade. Labeled it as a multi-purpose tool developed for adult behavioral health services to support decision making, including level of care and service planning, and to facilitate quality improvement initiatives, and to allow for the monitoring of outcomes and services. It also states that it's second edition of the severity of psychiatric illness tool, which I guess is similar. I'm not sure that, but in short, in response to Malaika's email summary, it's a little bit hard for me to talk about administrative burden, but I could see where something like pros and cons list, or maybe a little bit more in-depth sort of collaborative perspective approach like open dialogue is probably going to be more effective, and it has been in my own experience. So philosophical issues for me, I believe that DSM is a tool that we have for a very good reason. In my own peer work, I don't care to pathologize anyone but myself, but it's important for me to understand sort of the nature and condition of my own mental health diagnosis. So it's frustrating to me that each of, Malaika counted 58, I think, but it's frustrating to me that for the most part, there's 0 to 3 ratings, and a 0 is something that's actually good. So I like to think about incentive-based options rather than care which is deemed necessary due to a risk or danger. So, regarding your comment, considering overlapping questions, Malika, my biggest concern is that this is meant to be a tool which has a purpose for assessing level of care decisions and service planning, what level of treatment should come next. And the caregiver resources and needs portion of ANSA is an optional domain. So I feel like I don't know. The tool to me is something which seems a little bit more in line with the medical model than with a collaborative network approach or being trauma informed. It seems it seems more in line with considering levels of care, a decision for someone else and not the individual who may be getting screened or might be updating their service plans for the next year for case management at a DA. So anyway, thank you for your work on ANSA, and I think that's enough out of me for now. I was just wanting to sort of go through my thoughts regarding ANSA. So.
This is Malika.
Oh, go ahead, Malika.
I was just going to say that, I sent this summary out, and my thought or my recommendation that I wanted to see what the committee thought about would be to recommend to DMH that they identify a different tool to take the place of what the ANSA is supposed to do until we can develop or identify a tool that would be a better fit, rather than sort of locking ourselves into this tool, which no one, I think, thinks is ideal. So that was my recommendation, and I don't know if you all have any questions to get to a place where you know what you think about that recommendation, or if you already have thoughts on it.
This is Marla. I think that ANSA is completely counterintuitive to DMH's goal of wanting to be strengths-based. All of that strengths-based funding that Allison talked about last year. Bert is correct. It's entirely medical model. It's not trauma-informed. And like a certified ANSA staff person needs to conduct it. And I totally agree with Bert and Malika, what's been said, that something like a collaborative network approach or open dialogue or something more strengths-based and trauma-informed would be better. This really, really worries me, and I also don't like that. I don't like that a high number is bad. That also seems strange.
So, Malika, where would you like us to go with this at this point?
I guess I'm just I don't know where things are at with this right now. Of course, continued work on the ANSA has been suspended for the moment. I'm not sure how soon that will resume. So it is less urgent than it was, I think, but assuming that it will pick back up relatively soon as we sort of all get back to our normal business somewhat, it would be helpful to know if committee members agree with my recommendation or not.
Yes, I agree. And I would also add that I myself, maybe with some collaboration from members, could come up with a trauma-informed strengths-based assessment. Like looking at this right now, I totally could come up with my own form if I had to.
This is Vicky. This is Vicky. Thank you. I'd be interested in if there are any evaluations used elsewhere that that are more effective, that might be better.
I think if this is Tom Weigel again, I think if you have a recommendation to scrap something like the ANSA, it would probably be good to have something that you're potentially proposing in its place. The ANSA is both a needs and strengths-based assessment. You know, and anything that needs to be proposed needs to be what's called reliable and valid, meaning that it's been tested in certain populations, and repeat testing shows similar results or the same results, and this isn't a situation where we can write up our own survey and then end up basing payments on that. It's something that really needs to be reliable and valid, which maybe keep that in mind as you're looking at other survey possibilities.
So, yeah, Dr. Marla, I totally appreciate that. I just wanted to say that, something from the positive psychological model that is evidence-based and tested and evidence-based, that already exists. That would be something, if DMH really has to continue with ANSA, like, couldn't there also be a positive psychology survey?
I think part of the idea between the ANSA standing or working committee was to try to potentially work some of that into the wording of the questions as they exist, which I think Malika's done a great job of trying to help us out with and facilitate. I don't think if we ask the designated agencies to also do additional surveys, I don't think they're happy about the ones we're asking them to do already. So adding one more on would be a kind of a bone of contention with the designated agencies themselves, I think. But that's something you guys want to propose.
No, that's I agree with that, and I think we as I mentioned in my summary, we are working on making improvements, mostly by adjusting the language a little bit to be, I think, more reflective of what you're referring to, Marla. However, there's significant limitations in how far we can go with that, and also limitations in how much we can reduce the administrative burden, which I think does matter quite a bit because that ultimately impacts client care. And so my recommendation would be to use one of the other tools that was considered, the self-sufficiency matrix, because that is something people are already familiar with using. I think that would have similar level of reliability and validity to this. And then also, like, if we need something as a stopgap, if something better isn't found by the time this has to be implemented. I know that there were I wasn't involved, and I don't think the standing committee was involved at all when in the time period when a tool was being identified, unfortunately. And I think there were some other options that I've heard about in that process that maybe could be reconsidered.
I like the idea of a self-sufficiency matrix. I agree, Malika.
This is Vicky. I agree.
Yeah.
It's difficult for me to have a significant opinion because I have limited experience regarding tools intended to help with level of care decisions and service planning. So that seems to be the need, but I don't have a whole lot of experience other than what I've used in my own healthcare. So.
How many questions are on the self-sufficiency matrix?
That's a good question. I don't know off the top of my head. Maybe someone else does, or I could look it up.
I don't know that, but I do have the ANSA survey in front of me.
That has 58 questions.
It looks like the self-sufficiency has about 20. It does kind of a similar thing to the ANSA in that it takes each category, whether it's housing, employment, food, and it ranks as is somebody really self-sufficient in this, or are there deficits, which on some level could be argued is also a deficit model. And if there's deficits, are those things that can be worked on? So it's definitely shorter than the ANSA.
So this is Trish. Can you hear me?
Yep.
Yeah.
Yes.
Okay, so the self-sufficiency matrix was a tool that I'm actually pretty familiar with, and it varies from state to state, user to user, whether they use over 20 items or less than 10. It was developed as a treatment planning tool. It was developed as an instrument to have a conversation with someone around where they felt that they most wanted to address a particular need, whether it was parenting or whether it was housing or finances. It was never developed as an assessment tool. There's no validation, no reliability. There's also no one form of the test. So there were conversations around the self-sufficiency matrix, but in terms of being reliable and valid, there is no studies on that, and it wasn't developed to be used that way.
Oh, okay. Trish, thank you for that. And I want to add, too, that's exactly what I've been hearing about the ANSA. That it's been said repeatedly to me that the ANSA is not an assessment tool. It's just a place to capture the data from other assessments that you do. And it also functions in a very similar way of informing treatment by identifying areas of needs and areas of strength. So I think that it sounds like they're quite similar in both of those regards.
Yeah, I'm not familiar with the ANSA research. Tom may be, but I'm not. I'm just more familiar with the self-sufficiency matrix.
This is Vicki. I wonder if some of the members could get together and write up a report on, some alternatives that have been tested on the pros and cons of the self-sufficiency, and come up with a letter of recommendation that maybe we could vote on at the next meeting and submit to DMH as sort of an official recommendation, an official position.
I like that idea and would be willing to participate.
I'd be willing to help.
Me also, even though my experience is rather limited in regarding, I also would like to help if I can be of help in some way. So.
Right. Yes, I think that's a great idea.
This is Marla with a question for Trish or the doctor. Is there anything Myers-Briggs related in terms of surveys that would even collaborate or comply with psychology and mental health?
I don't think the Myers-Briggs is pertinent. I was going to say if there's some sort of proposal around the answer alternative surveys and a discussion around that next time, if we could schedule Allison to be present on the call for that time, that would be great. I know she's sick today and not able to do much for meetings on the phone even, but I'd encourage that.
Yeah, that sounds like a good idea. I think having, maybe it's possible even that she could be available when this subgroup or subcommittee, if that's what we're doing, meets to answer questions, because she has quite a deep understanding of the ANSA.
Agreed.
Allison also has a deep understanding of the, that's Caroline, who talked to the planning council about the movement towards a strengths-based point of view.
And Caroline has been involved in the ANSA development and implementation teams, I think.
She's a DMH employee or someone else? I'm not recognizing that name.
Yeah, DMH employee.
DMH employee.
Okay.
So, Malika, are you proposing that we form a subcommittee that meets offline, or do a draft and circulate it to everybody?
I thought that's what Vicky was proposing.
The former.
Oh, I don't know.
We kind of already did just form a subcommittee, the members who are talking right now.
How might I be able to contribute to a subcommittee regarding, at least sounds like the objective is at least to compare ANSA with the self-sufficiency matrix, and then maybe to submit another letter to DMH?
Yeah, I think we need a motion to clarify what exactly the proposal is, and then we can go from there. Vicky, maybe do you want to do that since you had the idea?
Sure. This is Vicky. I would propose creating like a shared Google Doc where we can first kind of submit information and research that we've done on pros and cons, kind of gather the similar information together and use that to compile a letter that we all agree with on kind of our position on recommendation for DMH. If that's acceptable to everyone, I'll make a motion to confer outside of the meeting and try to get with the goal of having a letter written by the next meeting.
Motion made. Is it seconded?
I second. This is Marla.
Okay. Is there any discussion around that?
Yes, I have a clarifying question. Is this like for any and all committee members who want to participate in that, possibly including everyone, possibly just a few people, but then will be brought back to the committee for final vote? Is that correct?
Yes, this is Vicky. Yeah, I think any members who want to participate should have access to the shared document.
Right, but not an expectation that everyone necessarily will.
No, not an expectation. That's why we would discuss the letter at the next meeting to make sure that everyone has the opportunity to weigh in and vote, have an official vote before we make it our official position.
Yeah, sounds good.
Any other comments or discussion? If not, then
I just have one more clarifying comment before the members take a vote. With whatever we come up with would have to be evidence-based and tested, probably.
I think we can make whatever recommendation we want to, but I think that's yeah, it needs to have some established credibility and reliability, I think.
Right.
That sounded
at
like
least the base part of it.
Before, so.
Any other comments, questions? If not, all in favor?
Aye.
Aye.
Opposed?
Aye.
Or opposed or abstaining? Okay, motion carries.
Can I ask if anyone wants to spearhead that initiative, that work?
I'm happy to, but I don't want to be like the top person, but I'm happy to do a lot of research about it.
Vicky, I'm happy to set up the Google Doc and kind of do some coordination, even though I'm admitting I don't have a lot of knowledge on the subject, but I can coordinate.
Great.
Thank you both.
Thank you.
And I can be supportive where needed, maybe for research into some of the results-based accountability that might help to support whatever our decision ends up being.
Great. Thank you, Bert.
Thank you.
Yeah.
Eva, would you be willing to see if you can get either from Allison or from, I don't know, records of meetings or something, the other tools that were considered along with ANSA before the ANSA was selected for this purpose?
Yep, I can absolutely ask for that.
Thank you.
Thank you.
Okay, so unless there's any other parting comments, then we'll move on to the next item on the agenda. It's about 5 of 2, and so we have about, if we to stick to the agenda, we have about 45 minutes for this second agenda item before public comment, which on the agenda it says committee communication and facilitation. And then there are questions about what are our strengths, what do we need to improve, how do we achieve changes. And if I'm correct, this agenda topic came out of was a response to, I don't recall whether it was the last meeting or the meeting before, where we demonstrated some less than ideal practices or interaction or mode of interactions, and we said we wanted to try to look at the way we operate, the way we communicate in the meetings, and how we facilitate. As I recall, I think specifically, Marla, you and Brandy had mentioned specific training that you had sort of around this topic. Maybe it was conflict resolution.
I have trainings from the past. The conversation, the catalyst, was from Brandy, which I thought was great. Something I suggested is something I did at the past at the origin of the Vermont Support Line as a community confidence, morale kind of building activity would be to, and the first question here is, what are our strengths? So at a future meeting when we have more members, maybe, like mention 2 strengths, and then maybe the third is like a growing edge or something. But what I had mentioned was Yalom's group psychology, which is that for several months the committee was kind of in a storming phase, which is there's forming, norming, storming, resolving, and adjourning. And this month we're in a resolving phase, and we started the resolving phase at the tail end of the meeting last month.
Thanks, Marla. Yeah, I remember that conversation also, and I think Brandy had some particular thoughts additionally that she was going to bring to this conversation. And so I'd like to motion that we defer this discussion on committee communication and facilitation, and instead allocate that time to discussing the plan that was shared with us this morning from DMH and how we want to proceed in regards to getting responses to our letter, and any other sort of urgent crisis response topics.
I would agree. I think Brandy and more members need to be here because this is This is really a conversation that needs more people, don't you think?
Yeah,
This is Vicky. I'll second the motion. I think Brandy had some really great points and had some opinions on this and would like to see her present for the discussion.
yeah.
I think that's a great idea.
Yeah, and I agree as well. And I guess I would like to specifically propose that I'm happy to reach out to Brandy to talk to her about this in advance of the meeting, so that and Marla, if you want to be involved in that, or anybody else, because I think this is obviously this is critically important in terms of how we operate as a committee and how effective we are in discharging our responsibilities. And I'd like to see this facilitated in an organized way. And I think Brandy definitely has had some excellent comments and perspective from being at those meetings, but also her background, like yours, Marla, has some, experience and training to bring to the table. So my proposal is that I reach out to Brandy and talk to her about this, about seeing if she's willing to perhaps facilitate this discussion, or at least come up with an agenda so we can have a more organized conversation around this topic.
That sounds good, Dan.
Is everybody on board with that?
I'm on board with that.
Yep.
Okay.
Yes.
Please do.
All right. Super. So
By the way, there was a motion in a second, so now we need to vote.
Okay. All in favor?
Aye.
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 Opposed? Abstentions? It's unanimous. Passed. So, pursuant to Malika's suggestion that we all agreed to in the motion, do you want to start us off, Malika? Was it some specific questions, issues?
Yeah, I did have like at least one, maybe more clarifying question that someone from DMH could maybe respond to, which is, it says in this document that we got that the Middlesex residents have moved over to VCPH and are not subject to emergency involuntary procedures. And my question is, are they normally at Middlesex, or is that just clarifying that they still won't be? Or is that like a change from their normal situation? Or is that, I gather, I think that emergency involuntary procedures are still happening elsewhere in the system. So if Trish or whoever wants to speak to that, that'd be great.
So this is Trish. Tell me again the exact question around Middlesex and involuntaries. Is that it?
It's about emergency involuntary procedures. Do Middlesex residents normally have the potential to experience emergency involuntary procedures, or are they just not right now?
Nope. They can't. The only setting in which that can occur at this point is in a hospital setting.
Okay, and so that's still happening in hospital settings, but that's not happening to the Middlesex folks, even though they've moved over to that facility.
That I don't know. I didn't hear what Sarah said, so I don't know.
Okay, thanks. I'm also, I know Sarah might share more information with us about this, but as I understand it from reading through this document during the meeting as quickly as I could, is that when a patient tests positive for COVID-19, then they will be moved into this special unit. And I guess I can't quite wrap my head around how that is going to work, because if someone positive, then I would assume that everyone else on the unit that they're coming from has also had exposure, and that's an issue unless there's going to be very widespread testing. I don't quite see how this is going to really prevent the spread within institutions.
I don't see how 10 beds for that is enough either.
So this is Trish again, and again, I missed what Sarah said, but I assume it's going to be a little bit like corrections where they had a positive case, then they tested folks, and then the folks who were positive, they then removed them into a different site. But you're absolutely right. It would require testing the other staff and residents or patients.
Right. Do you know if there's any widespread testing happening within our facilities now?
I don't know.
Okay, thanks. Also, on the graph that shows the hospital census, I thought the total number of inpatient beds was 187, and the total numbers in early March are it appears to be up to 200. I'm confused about that also.
So the number of inpatient beds can change by the day. The document or the numbers that I sent you earlier were the count as of that day, and that included some closed beds, some open beds, some occupied beds, beds open and closed based on the milieu. So how many staff are available and accessible, and what the current needs are of the clients that are in that facility. And so that can change the number of beds that are open at a given time.
Please excuse me, this is Marla. My phone is about to die, okay?
This is Vicki. I just want to go back to the statement that psychiatric hospitals and inpatient facilities are not doing widespread testing. Given the 13-foot contagion radius and that this, the widespread outbreaks in community living and hospitals in Vermont already, and that medical hospitals are doing, daily testing of, everyone who comes on shift has to have their temperature taken at the beginning of their shift, has to, change clothes on the premises. It seems like there's widespread testing being done in other similar facilities where contagion would be an issue. I'm just kind of curious about DMH's, what DMH's choice not to do widespread testing would be based on.
Yeah, I think that is exactly the kind of point where it would be helpful to have a response to each of the points in our letter, because I think it's a very big difference in terms of our role in advocacy and advising AMH, whether that's not happening because there aren't tests available, or because a different population is being prioritized for a small amount of tests, or if there's a sense that that's not necessary. So I think that question, Vicki, really illustrates why we need information from the department. And I understand and respect that people are working hard. I'm also working extremely hard, and we would like to work. I would like us to work hard together, and I feel like we can't do that without having more information.
This is Vicki. I just like to second that. I'm working on like community information referral lines, and working with the community and like mutual aid organizations, and people are calling in with concerns about, I need care. I've been recommended to go to an inpatient setting, but I want to know what kinds of precautions are being taken place so that people are wanting to be able to evaluate their risk, to know whether or not they feel safe approaching hospitals. So I think having just free access to information is really important during this time, even given how busy everyone is. It's just my input.
I agree with Malika. I feel like we could probably have some more specific answers regarding the questions, thoughts, and suggestions we put forth in that letter. So,
I think if people feel good about it, I'd like to propose that we sort of reiterate our request to DMH to respond to each of the points that we've made, and maybe with like an idea of, well, I don't know, I'm thinking of a time frame, but I guess people will just do the best they can.
This is Marla before my phone dies. Sarah did say that if we could pinpoint highlights of the letter that specifically we'd like DMH to address, that would be good. And also the 10-page document that was emailed at 12:12 today, that was also part of her or their response to the letter. But I'm agreeing. I do have to go because my phones are basically dead. So.
Okay.
So thanks everybody. I'll see you next time.
Thank you, Marla. This is Vicki. Just 2 points. I want to clarify that I'm hearing correctly that there is no widespread testing being done of staff or patients in inpatient facilities, because that's information I've been asked for to bring back to the community. So I want to make sure that I'm getting that accurate. And then also just kind of want to reiterate that I think so much work has been done to keep that letter, to narrow it down to the really important points and to make very specific suggestions. So I think asking us to remove larger chunks of that letter and try to sift through other documents that were provided after our meeting began that we didn't have a chance to really review before speaking with the commissioner, and then use that to pare down our letter further. I'm not sure that's necessarily a fair request. I think a lot of work has already been done, and I don't want to minimize the work of everyone who participated in making that letter as specific and targeted as it already is.
Yeah, thanks, Vicki. I agree with that. In the process, we were very intentional about like not including superfluous things and only really talking about what. So it doesn't feel like recommendations. I feel like are essential components of a comprehensive response. So if we, I would like to have a response to all of those pieces. I would be willing, however, to add additional questions based on the this new document that we have about what's happening. Because I do have I guess we've already asked for more information about some of those things, and we may or may not get that. But yeah, I don't feel good about taking anything out. Or just highlighting certain sections.
But do people feel we haven't gotten answers to any of the issues that are in that letter, though?
I feel like we've gotten answers, like they're not doing many of the things that we've recommended, which, there may be perfectly valid reasons why, but it would be helpful to know what those reasons are.
Okay.
For me, that's what makes the most sense.
All right. Yeah, I was the one made the initial suggestion about trying to highlight and focus what questions we have questions we have after we read the document and after having heard comments from Sarah and the staff members. But yeah, I guess I guess my suggestion, because we're trying to balance getting thorough responses to all of the questions that we have against DMH's staff time and ability to carve out time to help us go through this. So it seems to me we should ask the department to the best of their ability to respond to the entire letter, and recognize that we may not get all or detailed answers, but at least ask for for a comprehensive look and a response to the best that they can, given time constraints.
This is Vicky. I would definitely support that. One of the concerns I have is, since I have people kind of asking me for this information, having something in writing makes me feel a lot more confident that the information I'm putting out there, how I'm representing the information I'm getting from DMH, having it in writing makes me feel a lot more comfortable that I'm representing accurately. I get a bit nervous going out saying something like, there's currently no widespread testing in inpatient facilities. I want to make sure that's correct before I distribute that. So having it in writing makes me feel a lot more confident that I'm understanding it correctly.
Yeah.
And that seems important. Even as busy as everyone is, the last thing we need, the last thing that saves anyone's time, is distributing inaccurate information.
I agree, Vicky, because I regularly participate at Westview with Howard Center, and I have a job there now, so it's important for me to be appropriate and accurate. So I agree with you.
Malika, do you think it would be counterproductive or not a good idea if any members like myself were to go through the document and just highlight sections that, for example, I in particular want to make sure are answered? I recognize that kind of opens the door for them just to focus on that and not everything
Right, that
else.
would be my concern. Yeah.
Yeah. Okay. Well, I think the document represents it's full and comprehensive, and I think it does make sense if we get feedback to the best from the department to the best that they're able to provide.
Yeah, and they may choose not to, and I don't know what that will mean, but it seems to me that it's in everyone's best interest to be collaborative and very transparent about all of these things. Literally everyone's best interest to do it that way. And I want to be able to follow up to all the people who said, let me know what DMH's response is. And right now, my response to those people is going to be, we didn't get any specific response, but here's this document that was shared with us. So it'd be great, I think, for DMH also to, address things more specifically. And I imagine that a lot of that is going to be like, we don't have the resources to do this, or we don't have, the time to make this happen. And that might open up possibilities for support from other places to try to make some more things possible than are possible right now.
Would you have a problem, Micah, if in reviewing the document and responding, if they felt as though it was addressed in this document, or maybe there are other documents they could provide, that they could just reference it?
I think that that's fine. And I guess what I imagine could happen is, like, in regards to our request that people who want to leave the hospital and have a place to go are able to do so. they, for example, might reference these numbers which show a decrease in inpatient census. But so in that situation, I would still want more and do have follow-up questions because they said that the criteria for letting people leave the hospital has not changed. The weighing of sort of the risks and benefits, it sounds like, has not shifted, and yet the numbers are going down. But we're hearing from Fox that perhaps that's due to fewer people presenting in ERs and crisis to seek inpatient. So I guess like it'd be really important to know, are they releasing people who they normally wouldn't, and how are those decisions being made? It sounds like that's not what's happening, but yeah, I guess just as an example of like when just referring to this document would still leave a lot of wouldn't totally address the recommendation, but there might be places where it would. So I think that's welcome if in fact the question or the recommendation is actually fully addressed.
Right.
This Vicky, that point also caught my attention about the number of inpatients decreasing so rapidly without there being any official policy changes to changing who gets care and when people are dismissed. And I think Morning Fox mentioned, when he mentioned that some of that is due to people being discharged, which would seem to mean that there has been a bit of a change, and some of that being due to less people presenting. If there's that much of a difference in the number of people presenting, what that drew to my mind is that would seem to indicate that the public is concerned about seeking inpatient services, that people who normally would are not due to the pandemic. So, that would seem to definitely support being very transparent about what steps are being taken inpatient to protect against contagion. If that's really the reason that so many fewer people are seeking seeking help, but also just if DMH has thoughts about why so many fewer people are presenting for help right now.
Yeah, which I asked on that last point, Vicky. I did ask at the end that Morning provide that. So I think I think he did agree. He said he didn't have any statistics or data per se, but they have impressions and ideas as to why that's happening.
May I ask a question as a member of the public?
Sure.
Is anyone from DMH still on the call?
Yeah.
And who would that be?
Hi, Trish.
Okay. Does anyone know if Jennifer Rowell is still the person to whom public records access questions requests should be directed?
This is Eva from DMH.
So.
Excuse me?
That too, right?
Go ahead, Trish.
Yes, I believe that's fine if you want to direct your public information on access questions.
And does DMH currently have a medical director?
Yes, he was on the call actually, Tom Weigel.
Okay, because it seems like the medical director should be aware of whatever the testing is at hospitals, including the ones that DMH has jurisdiction over.
Yes, I'm sure he is. This is Trish. I'm the adult director. I don't know that information for sure.
Well, one way to inquire would be to put in a public records request for any policy or directive or communications with the hospitals concerning this. That was generated in, let's say, since March 1st. And possibly I am making that request orally right now. I mean, I don't think it's okay to withhold this information if it exists, and it's hard to understand why it wouldn't exist.
So this is Eva from DMH. Can you send that records request to Jen Rowell just so that we can get it back to you?
Sure.
Thank you.
I'm just curious how DMH sees its own responsibilities on this point. There's statutory requirements or delineation of the commissioner's authority, which would seem to make it mandatory, or a gross abdication of responsibility if it wasn't considered and undertaken.
And this is Dan. Just to make it. By the way, was this Laura that's just been speaking?
It is.
Yeah. Just to make it clear for me, when you say it, what is the specific thing?
Testing for COVID-19.
Right. Absolutely. I think that's a very, very, very fair question.
Well, I don't think it was answered at all during this call, and I think it was made very clear that there's a strong interest in that answer.
Right.
And as far as I can tell, under powers and duty of the commissioner, it's pretty clear that it's included implicitly.
This is Vicki. Given that Dr. Weigel is on the phone right now, I wonder if we could direct that question to him.
Well, I did. I just didn't think it came across very clearly, so thank you.
This is Eva Dan. Dr. Tom actually jumped off the call about, I think, 20 minutes ago or half an hour ago, so he actually doesn't hear your request in this moment, but I will put it on the list of things to follow up about.
Mm-hmm.
And
I'm done. I don't want to take any more time.
All right. Good question, Laura. Thank you.
Mm-hmm.
Yes, thank you, Laura. I appreciate you being here.
Yeah.
Eva, you'll share that that info with the committee.
I think it would help if the committee asked as a public records request.
Okay.
I think pretty much everything needs to be framed that way if the department is not reasonably forthcoming.
And Laura, I'd like to include you in our response to that. I don't have contact information for you, so I don't know if after the call or in the chat box for this, if you could include some contact info, that would be great.
I'm not using a chat box. I'm using a phone, but Jennifer Rowell, if she saves any back messages, will have my contact information since I used to be a frequent public records requester. And I can send it to her directly just as a reminder. And if necessary, I can do the request, but I really think it should be coming from the standing committee.
This is Vicki.
Yeah.
I'd be happy to make that request on behalf of the committee if other committee members are in agreement of that.
Yeah, I mean, I can send you a template. It's just that the opportunity to inspect is now non-existent, I would presume, because of safety protocols.
Would it be fair to say that given Vicki's presumption that perhaps inpatient numbers may be down because of uncertainty regarding potential exposure to COVID in inpatient units, if it's not information that is readily provided? I mean, that would be a presumption not founded in statistical reality, but perhaps something that would be an important thing to include in this request? I don't know. I'm asking.
I'm leaving it up to the committee in part because I do not want to pay for records. And I think that it would be questionable for the department to charge the Adult Standing Committee for access to records which should be affirmatively provided.
I'm not particularly good with treasury items, but as someone living in poverty who's doing this on a small stipend, I think that it would be a fiscal burden for me to have to donate
Same
some
here.
of my
No, same here. I'm just, what I'm trying to say is that it should be extremely embarrassing for the department to be charging people for access to records which should have been provided without even being asked and which have yet to be provided, or at least the information hasn't been provided, even though the department was asked some time ago. This is a tool that you shouldn't have to use. And since opportunity to inspect does not have charges, at least not by law, except that it really isn't realistic at this point because of safety issues. You do not want to go into buildings, and you really should not use hard copy or require people be exposed to hard copy if you can do it electronically. It seems to me that the department should have been initiating this and should respond to it and should waive charges since you are a committee that is advising the department.
Yeah.
Laura.
Laura,
Vicky, this is Vicky. This would seem to be a question maybe we could direct to Eva. If the committee makes a records request, will the fee be waived?
So this is Eva. I'm not familiar where the fee is coming from. I'm happy to share any records that you're requesting.
If you ask under the Public Records Act, there's a fee schedule.
Yeah.
Opportunity to inspect does not have charges associated, although that doesn't mean they don't attempt to impose at times.
Yeah.
But copies can be charged for.
Yeah.
And it's spelled out how and what the charges can be, what they're based on. I don't want to incur those charges. That's all.
Laura.
Okay.
Laura.
You don't have to keep saying my name. I hear you. I'm not talking.
Sorry. Sometimes the technology gets in the way. I apologize.
Mm-hmm. That's all right.
I just wanted to say I've been on the committee now for 4+ years, and the issue of fees, paying fees for record has never come up. And I think any question we ask, if there are public records relate to that, Eva, you can correct me if I'm wrong. The Department of Mental Health will provide that to the committee, and that there's the fee issue.
I understand this. If you haven't had to resort to asking under the Public Records Act, then there are no fees. As long as the records are provided gratis by the department in your capacity as adult standing committee, it's quite legitimate for you to ask. But if they're not provided and you need to resort to it, fees have been a barrier in the past.
This is Malika. Laura, I thank you so much for your input around this. It's really valuable to me. And I would also expect that DMH wouldn't charge us if we used the public records request for copies. And until or unless that happens, maybe we can
move on.
Assume that that's not going to happen. If it does, we'll deal with it at that point. But I love this idea of using that function, which I often forget exists. And I wonder if the committee thinks we should go ahead and do a public records request immediately for any documents that would answer any of our questions. I don't know how exactly you asked that, but I'm sure we could figure that out. Or if we should wait till the end of till tomorrow or something to see if if we get answers in a timely way. What do people think?
This is Vicky. I am really looking forward to hopefully getting some responses from DMA to the specific items listed in our letter. But I think Laura brings up requesting policies from policies that have been enacted by DAs and by DMH. If those are public record, I think getting those particular policies would be really valuable information for the committee to have, and that would seem appropriate to a public records request.
Do you see any barriers or issues there, Eva?
So as long as we're clear on what you're requesting, you can make the request verbally as a committee, and I'll get back to you. And I don't think there should be any barriers. I can send along via email anything that you request that we can get. Yeah. Let's be Ganesh. Let's remove all those obstacles.
Yeah.
Thank you.
Okay.
So Eva, you're recommending that we not make it as a records request, but just make that directly to you, and you can try to get that information from DAs and from DMH?
Correct. I'm going to send out an email after this to try to clarify. I think I've heard what the requests are, but I just want to clarify specifically. And so I'll just include that in my follow-up email. And I would suggest, if you're hoping that leadership from DMH will be giving you responses to any requests that you made during the meeting time, that you probably give them about a week to try to turn around something, because who knows what they get pulled into between when they were meeting with you and the end of the day. But usually they'll get back if they're going to.
I think when we submitted our letter, there was kind of an implicit request that they respond to it. So I mean, we can reiterate that we're still waiting on that response. I think the general information that we were provided with today was not necessarily, like my impression was that would not be a response to our letter, as it doesn't address the letter, but I'm interested in hearing what other committee members think.
Yeah, I think the request was implicit, and then it was also explicit last week, I think, or maybe the week before. So, yeah, I feel like the clock has sort of started on that for me. But I don't know if, in addition to asking that they respond to the letter, if we can, well, yeah, I don't know if I'm a little unclear about if we're sort of doing a verbal public records request through you, Eva, and if so, if we can sort of frame that as any information related to, you know, the conversations about or policies related to or decisions related to each of the bullet points in our letter.
Yeah, and I honestly...
This is Vicki.
Go ahead, Vicki.
I just wanted to volunteer that the letter was sent to the commissioner, I believe, on March 31st. So we're about almost 2 weeks into that. But yeah, I would just request any. I wonder if we could make it as broad as any official policy changes by inpatient facilities and by designated agencies in response to COVID-19. Would that be too broad, or would that be too specific? I'm interested in what other people have to say.
My impression is that if they were to answer that thoroughly, that might be a tremendous amount of information.
In that case, it might be more appropriate to do it as a public records request, because those would be public records requesting policies. So that would go through somewhat more traditional channels in that way.
Yeah.
I'm a little bit lost in the specifics of defining this request, but I feel like we need some sort of answer to you know, the thoughts and concerns and suggestions that we put forth. I also am somewhat uncertain and maybe led to believe that the document that we received today after the start of the meeting was something that was already completed procedurally and may or may not serve sort of a dual purpose, which is fine, and there's a lot of good information on that document, but not necessarily a response specific to the explicit issues that we brought up.
This is Vicki. I'm seeing kind of two separate issues here. One is us wanting to get a response to our letter, and then the other is wanting access to policy changes, that background information, so that we can be educated about what DMH is doing. The letter kind of puts forward, you know, what about this solution? What about this solution? It puts forward very specific ideas, and I think we want to get responses to those ideas. But then I think as a separate issue, having access to the background information of what is being done. And I think the 10-page document we were given does provide some of that information. But if we do it as a records request of we would like to see all of the policies, that way it's not a summary of kind of what the commissioner is presenting, but kind of gives us the background information in a broader format that we can kind of. It also tells us what, you know, what isn't being done or what is being done. I would feel more comfortable distributing information, answering people's questions if I had that info.
Vicki, the issue when I hear all records, then to me that kind of opens the door for all types of things that really that we may or may not be interested in. But my sense is, I mean, would it be, Vicki? Would it make sense if we were to say we're really looking for as detailed and comprehensive responses to the letter as possible, including any public records related to the letter.
I see these as two separate issues. I want to get a response to the letter, but then I'm also interested in seeing the public documents that are being created in response to COVID-19 to keep staff and patients safe. I see those as two separate issues. One is having the information at our fingertips to know what's being done, and the other is the response to our letter.
Yeah, because I guess maybe I'm getting hung up on thinking about administratively. There's tremendous number of things that are happening relating to changes in policies and procedures and operations for relating to this virus.
Sure. If we feel like it's too broad to say we would like to know any policy changes regarding COVID-19 within DMH, what would be a more specific way of editing out the information you don't want to receive?
Well, what I was trying to propose is that the letter, and then any additional questions we've raised today, like Laura had some excellent comments about testing and so forth, that we use that as the way to define the scope for them. Maybe there's another approach. That's just the way I'm thinking about it.
Hey, can I say something?
Malika. Oh, go ahead.
Bert, go ahead.
I was just gonna say quickly. I agree with Vicky in that I feel like my own personal needs are only to be well informed enough to talk generally but accurately about the measures that are being taken, especially in how they might affect people that I might interact with around Westview or in the Hearing Voices group with Pathways. And I think it's also important to acknowledge that in fairness to DMH, this virus is minimally a 100-year event, and it's not something that is a day-to-day operational change. So I think in fairness to DMH, there's a lot of things that take priority to us being absolutely 100% informed. Is that the right word to say? I don't know, but anyway.
So maybe Vic, maybe it would make sense for Vicky to make a motion. So
Can
we can
I share a thought first?
Sure. I'm sorry, Malika. Go ahead.
That's okay. No worries. I feel like the information that I most need and want to is the responses to the letter. The changes in policies, I think, would be very nice to know, but I also want to be mindful about our, relationship with DMH, particularly during this time. And I feel like we've been very clear, and it feels very, very genuine to me that the effort is to be collaborative, and that our interest in being informed isn't about just it's nice to know, but to collaborate in saving lives and preventing violations of people's rights. And so I want to maintain a lot of clarity in our relationship that is the goal, and that is what we are wanting to collaborate and cooperate towards. And it might be necessary at some point to look at the different policies, but at this point, I would prefer that we prioritize asking for responses to our specific recommendations, and not doing a public records request for all policy changes, because I'm afraid that would be viewed as in some way antagonistic, or I don't know, lead to resentment about time. And so I would recommend we prioritize the letter, and if we don't get a timely response to that, say later this week or something, then we do a public records request that attempts to answer the questions that we're looking to have answered in the letter.
I note that I mean that's valid, and I recognize that, and I do think that the priority is getting are getting a response to the letter. I'm seeing them as separate issues. I'm not seeing that the person who would be spending the time responding to our letter, which would hopefully be like the commissioner or the assistant commissioner or deputy commissioner, would be the same people doing, the same people spending time fulfilling a records request. So I'm not sure that that's necessarily, that should be straining a relationship to seek information that's public record. My main concern is if we're concerned with not just what's being done, but being able to be confident and accurate in conveying what's not being done. If we get, a letter from DMH saying, hey, we are doing, A and B, doesn't necessarily tell us that they're not doing C. They may just not have mentioned it. But if we do a records request, we know definitively what is being done and what isn't being done through policy, then we can be more confident in saying, oh, it looks like widespread testing is not being done at facilities. Like that's a really important thing to say, and that's being able to define what's not being done. That's not necessarily conveyed very well in a letter, but in public records, it seems to be that would be a more efficient way of getting that information. But I'm seeing them as two separate issues, and if asking kind of,
so this is Trish. Can you hear me?
Yes.
Yes.
I can.
So just an FYI, a public records request we take very seriously. It does mean that anybody who has been in any meeting or done any emails on that topic has to go through all their meeting notes, all their documents, and all their emails. So we do take it seriously, but I do want to let you know it does take significant amount of time. Which doesn't mean that you shouldn't do it, but I'm just saying that it's not necessarily easier or quicker.
I'm a bit concerned that we're needing to consider whether requesting information damages our relationship with DMH or is seen as antagonistic, because it would seem like having access to that information would be well within our role as an organization, and trying to I'm getting a bit uncomfortable worrying about kind of maintaining positive relationships. It seems like this is more of a business relationship than something where we need to worry about repercussions for not being sensitive to what's wanted from DMH. Like, I don't know. I'm just.
FYI, it's 2:47, and for this topic, really, public comment is scheduled for 2:45. So we're now into public comment period. So I think we need to come to a conclusion on this issue and move on. So I guess if someone wants to Vicky, if you want to make a motion, let's vote on it.
I won't make a motion. I don't think we have consensus, and I think that we do have private individuals. We can each make requests as individuals if we see fit, but I don't want to take any more of the committee's time, and I don't feel like we have consensus at this time, so I don't want to push for it.
Leaving it at that is okay for me too, and maybe we can continue checking in about this topic between this time and our next meeting, even perhaps later this week, depending on what happens and as we think more about this.
Right. Yeah, I absolutely am on board with keeping the issue of the public record on the table. But see what response we get in the next week or two.
That works for me.
Okay, so Eva, are you clear what we're looking for, what to communicate to your colleagues?
Not exactly, but I'm gonna send out an email, if not by the end of today, then tomorrow, that highlights what I heard as next steps, so I can just clarify.
Yeah.
So this is Vicky. My understanding is that we're just still asking, we're still waiting for the response on the letter from the 31st. Is that correct?
Yeah, I think, and maybe to modify our previous request of a written response, but I would like the committee to request a comprehensive written response that addresses, not necessarily in links, but at least clearly each of the recommendations and yeah. And then also, well, I guess this would be part of it, but particularly what is the status of testing?
Right.
I agree with that.
Okay.
I agree.
Okay. So unless anybody has anything else, we'll move into public comment. One thing I just wanted to say to Laura is I really appreciate your comments and input, and I again want to apologize if I came off as being too abrupt.
There was nothing to apologize for whatsoever, and I appreciate having the opportunity to give that input, and hope it wasn't unduly disruptive of the meeting.
No, not at all. Not at all, Laura. Thank you. Yep. So it's the floor is now open to any member of the public who's on the call.
This is Kate. I'll just jump in to say this is a very fascinating conversation. It seems really important, and I look forward to it continuing. It seems like it has implications not for just very immediate present day, but also as sort of a working condition going forward in terms of how communication happens.
Great. Thank you.
This is Lynn Cardozo. I just want to say thank you for letting me sit in today. And I think my only comment might have been a question earlier, but we only had so much time for the commissioner. And I'm interested to know whether the volunteer corps that the governor is putting together has any role with our mental health community. So,
and when you say volunteer corps, I actually right before this meeting came on, I was watching the Governor Scott's update, and they have scrolling on the bottom a URL where you can volunteer. And is that what you're referring to?
That is what I'm referring to, and it's a very interesting time right now, resource-wise, because of course everybody's, concerned because there aren't enough resources because people have been sick and laid off or whatever the circumstances are, and so now there's all these people out there who are not working, but really wants to, then there's the risks of doing the work that needs doing, and it's complicated, This the volunteer corps thing that the governor's office has put together basically has two categories. One is medical, and one is other. And I was just curious to know whether there's any resources that might be coming in, or people signing up who are retired, or there's any number of reasons why people might be available, and that would have been my question, because all my other questions got answered but that was just sort of a miscellaneous question that I wondered about.
Yeah, Lynn.
Yes.
I just went to the website for volunteers affected by COVID-19, and there's two boxes. One is a general registry for volunteers, grocery workers and whatnot, and the second is medical volunteers.
Right.
and it says nurses, pharmacists, CMS, physical assistant, veterinarians, mental health, etc.
Right. So even though we as a group, can't answer the question that I would have had, I was just throwing that out to the committee that had there been time, I would have liked to have heard what the commissioner might have to say about what kind of potential resources might be coming in through that effort for the mental health community.
Right.
This is Malika. Eva, could you let the committee know if you hear anything about that?
I absolutely can, yeah. I haven't heard anything up to this point, but if that changes, I'll let you know.
It's a excellent question, though, Lynn. Thank you.
This is Vicki. For what it's worth, I have gone to that website and have signed up. And I signed up under mental health, and it asks, there's two sections. One is if you're a licensed professional, and one is if you're a non-licensed professional. And I signed up under non-licensed professional, and signed up under, peer advocate. It asks you, what kind of training you have, what kind of experience you have. And then the follow-up I got, they ask rather extensive questions about background checks. So that's kind of the stage I'm at right now, is they're asking you to answer extensive questions about all the places you've lived, and it's a pretty exhaustive intake process. But just for what it's worth, that's as far as I've gotten with it.
Yeah.
Thank you for that. I did a little test entry because I wasn't quite ready to sign up because I'm extremely busy right now. But it's good to hear what that next. I would have had to push the next button to get to where you got to. So it's good to hear that they're doing the back checks.
Great. So it's 2:56. Are there any last comments or questions from public before we move into talking about the agenda for next meeting? Okay. So I guess the bottom of the agenda, today's agenda, Eva, as she always diligently does, gave us a draft agenda for May. I'm looking at it right now. It says we are I guess I'm having a hard time reading it, Eva, but what's going on with CSAC?
So the short version is May's agenda originally was reviewing CSAC documents so that you could meet with the committee the following month in June for redesignation. All the quality processes, including designation, are currently on hold because of this, because of wanting to respond to the virus and really prioritize that for agencies as well as DMH. So your May agenda is very open right now for anything that you'd like to do because the quality processes are paused. And so we'll just let you know when they resume and adding those back in. So currently, as we look at the May agenda, I heard, let's see, there might be an answer recommendation letter coming out. So you'll want to discuss and vote on that as part of your state program standing committee business. I know you still have the responsibilities of the committee letter that hasn't been sent into commissioners. So if that's something you want to discuss and potentially finalize, maybe you want time for that in your agenda. I'm assuming you want time for a DMH update, and you also wanted to loop back into the conversation about committee communication and facilitation. Is there anything else that you'd like to make sure gets on there during state program standing committee business?
This is Vicki. Given current circumstances, I think having at least a little bit of time set aside to discuss the pandemic response would seem appropriate, if that is agreeable to other committee members.
I would agree. Yes, I think that should definitely be an agenda item.
Vicki, are you thinking that as a subset of the DMH update or a separate discussion amongst ourselves?
just knowing how these meetings have gone in the past, I think setting aside a little bit of time to discuss amongst ourselves, I'm sure we will have things, useful ways to fill that time.
Okay, and maybe we could schedule that before the DMH update then, so we can have our conversation and then perhaps be better informed when the DMH representative talks to us.
I think that's a great idea.
Okay, yeah, yeah. Any other ideas? Any other suggestions for the agenda? To me, it sounds like particularly the agenda item around the committee's improving committee effectiveness and efficiency and communication and facilitation, that could take up quite a bit of time. So my
This
sense
is Lynn. May I ask a question relative to the agenda?
Sure.
So I've been seeing significantly increased, at least visual efforts for suicide prevention. And I have to admit that sometimes I'm questioning whether what I'm seeing is doing what it's supposed to do, or whether it's giving people ideas. But anyways, that's just, there's definitely some increased energy on the part of organizations that whose mission is to try and address suicide. And I just wondered whether that's anything that this committee focuses on or would be focused on as a part of your COVID discussion, because suicide has statistically increased.
This is Vicki. That really ties into an issue I've been working with some mutual aid organizations, where a lot of mutual aid organizations are encouraging community members to call in with any needs that they have, and they'll try to route them to the right organization. But they're not necessarily individuals with a mental health background. So kind of what I've been coming up with, people will say, well, if a volunteer calls in and is expressing suicidality, we'll just tell them to hang up and call 911. We don't talk about that. And I'm saying, well, how do you know, like, what type of suicidality, like how severe? It's like any kind of mental health crisis, if they sound like they're having a crisis, we'll just tell them we don't deal with that and we'll hang up. And it seems like having, it seems like there's a lot of work that we could be doing, and this is maybe going off a bit tangentially, but finding out what those resources are. I know that there are increased resources during this time around mental health, but so much is being mobilized so quickly by so many different agencies that really bringing that information together and making it accessible is something I've been kind of looking into, and seems like it maybe falls into an interest category that this committee might be interested in.
I'm not meaning to talk over you, Vicki. I'm sorry.
Go ahead. I'm done.
No, go ahead, Bert.
Try to reach out to the Columbia Lighthouse Project and see if any of their efforts, which from what I understand have been ongoing regarding the Lighthouse suicidology tool, does it make sense, because New York is such a hot spot for the virus, to reach out and maybe try to collaborate or see if they have some sort of ability to respond in short via an email or something like that?
That would be great if we could add that to our agenda to have maybe a bit of a discussion about that. I think we definitely want to give a lot of time to discussing the committee, kind of the discussion that we postponed today, so that Brandy can be present. I think that needs to have significant time, but if we can have a little bit of time for this, I think that would be very relevant.
Or would people be okay if we pushed it ahead to the the June meeting and allocate a substantial amount of time to the broad topic of suicide prevention, including perhaps, input from what Bert can gather?
Well, I think the other thing is we've spoken a little bit about the tool in the past, but maybe not as extensively as we have hoped because of our responsibility to complete the DA evaluation.
Maybe we could just have a very brief discussion, just maybe 10 minutes, where we all kind of put forward the tools we're aware of within the community and kind of share that information with each other.
About the topic of suicide, Vicki?
Yeah, since that seems like something that would be pretty related to the pandemic. I'm already seeing some articles about suicide rates possibly increasing due to it, so that would seem pretty relevant right now.
Yeah, no, I agree. Yeah, and we could. What you're proposing, we start the discussion next week, and then we can. Yeah,
with the understanding that it wouldn't be too long, it wouldn't take over other aspects of the meeting, but maybe just a quick sharing of resources would be really helpful.
I think that's a good idea.
Does it make sense to footnote some of the other tools that might replace ANSA and suggest the I think it's the Lighthouse tool? Maybe that can fall under the work that we're going to do between now and in May. But
yeah, I think that's right, Bert. Yeah, I think that's a great idea. Include it as part of the information gathering that we're going to do relating to ANSA.
Okay.
It's
Cool.
3:06. It's 3:06. Just so everyone knows, we're running a little over. Are we comfortable? We have the agenda set for next week.
I am anyway.
I am.
Is everybody okay?
Yes.
And Vicki?
Yeah.
Vicki, if you have time, I'd like to talk to you offline about this, what you were just talking about, the screening issue on the phone.
Oh, I would love that. Thank you.
Yeah. And FYI, speaking of which, I want to make sure everybody's aware that the Vermont support line hours we're now open from 10 in the morning till the following morning at 6 a.m. So we're open 20 hours a day, and we are slated to go to 24/7, hopefully in the very near future. Just FYI.
That is awesome.
Wow. So.
Okay, so if there's no other comments or questions, are there any other comments or questions before I ask for a motion to adjourn? Then can I have a motion to adjourn?
I'll make that motion. It's Vicki.
I can second, Bert.
Okay, all in favor?
Aye.
Aye. Opposed? Abstentions? All right. Motion passes, meeting adjourned, and thank you, committee members, for all your great comments and questions, and also for those members of the public who also contributed, and of course the DMH. I thought we had a good, productive meeting today.
I agree, Dan. And just as a quick fun footnote, I think if we turn the corner regarding ANSA and put together a good suggestion, perhaps we should think about referencing a movie called The Peanut Butter Falcon, which is more of a developmental disability thing, but it's a